Committee on Human Services will now come to order. The clerk call the roll.
Chair Frank,
Here.
Vice Chair Rose,
Here.
Representative Click, Representative Shaheen,
Here.
Representative Ramos,
Here.
Representative Noble,
Here.
Representative Campos,
Here.
Representative Hull,
Here.
Representative Manuel.
A quorum is present. Members, today we're going to take up, I appreciate everybody being spot on. Members, today we will take up pending business and hear new bills and take public testimony. A reminder of those in the audience wishing to testify on bills listed on the agenda, you will fill out a witness affirmation form, or you must fill out a witness affirmation form. Please do this at the witness registration kiosk outside the hearing room. Chair recognizes Chair Click is present. If you need assistance registering, you can approach our Assistant Clerk, Blake Albright, to help with registration. You can also speak to him if you require a translator or if you have a disability for which you may need assistance. If you've already registered and wish to change your position, please let us know when you're called to speak or see the Assistant Clerk. Please don't register twice. Testimony will be limited to 3 minutes. There's a timer. When the light turns yellow, you have 30 seconds remaining. When the light turns red, please wrap up so that members may ask questions and don't feel the need to use your entire 3 minutes. If you have handouts that you wish to distribute, please give them to the Assistant Clerk at the desk and he will distribute to the members. Members, any questions? Seeing none, I appreciate y'all being here. We're going to vote bills out quickly, and then I've got to head out to Pub Ed to lay out a little bill. And Vice Chair Rose is going to take over for the day. So the chair lays out House Bill 211 as pending business by Representative Mary Gonzalez. Members, we heard this bill in committee last week. HB 211 relates to the regulation of child care facilities and registered family homes providing services to children with disability or special needs. Representative Campos moves that House Bill 211 without amendment be reported favorably to the full House with the recommendation that it do pass and be printed. Clerk will call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Aye.
Representative Click,
Nay.
Representative Shaheen,
No.
Representative Ramos,
Aye.
Representative Noble,
Nay.
Representative Campos,
Yes.
Representative Hull,
No.
Representative Manuel.
There being 5 ayes and 4 nays, the motion prevails. The chair lays out House Bill 1238 as pending business by Representative Van Dever. Members, we heard this bill in committee 2 weeks ago. House Bill 1238 relates to the school health and related services program, including parental consent for program services, the establishment of a school health and related services program advisory council, and the publication of the Texas Medicaid Provider Procedures Manual. Representative Hall offers a committee substitute. This committee substitute ensures that HHSC can require parental consent where personally identifiable information is exchanged between school districts and HHSC. It also prohibits HHSC from requiring unnecessary parental consent when personally identifiable information is not exchanged between school districts and HHSC. Is there objection to the adoption of the committee substitute? The chair hears none, and the substitute is adopted. Representative Hall moves that HB 1238 as substituted be reported favorably to the full House with the recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Aye.
Representative Click,
Nay.
Representative Shaheen,
Yes.
Representative Ramos,
Aye.
Representative Noble,
Aye.
Representative Campos,
Aye.
Representative Hull,
No.
Representative Manuel.
Aye.
There being 7 ayes and 2 nays, the motion prevails. Chair lays out House Bill 1357 as pending business by Representative Holland. Members, we heard this bill in committee last week. House Bill 1357 relates to Medicaid reimbursement for certain medication-assisted treatments for opioid or substance use disorder. Representative Campos moves that House Bill 1357 without amendment be reported favorably to the full House with the recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Aye.
Representative Click,
Aye.
Representative Shaheen,
Aye.
Representative Ramos,
Aye.
Representative Noble,
Aye.
Representative Campos,
Aye.
Representative Hull,
Aye.
Representative Manuel.
Aye.
There being 9 ayes and 0 nays, the motion prevails. The chair lays out House Bill 1673 as pending business by Representative Capriglione. Members, we heard this bill in committee last week. House Bill 1673 relates to training requirements for staff members of certain assisted living facilities that provide care to persons with Alzheimer's disease and related orders. Representative Click offers a committee substitute. The committee substitute helps clarify training requirements in mirror language that is already in statute. Is there objection to the adoption of the committee substitute? The chair hears none, and the substitute is adopted. Representative Click moves that House Bill 1673 as substituted be reported favorably to the full House with the recommendation that it do pass and be printed. Clerk, please call the roll.
Chair Frank.
Aye.
Vice Chair Rose.
Aye.
Representative Click.
Aye.
Representative Shaheen.
Aye.
Representative Ramos.
Aye.
Representative Noble.
Aye.
Representative Campos.
Aye.
Representative Hull.
Aye.
Representative Manuel.
There being 9 ayes and 0 nays, the motion prevails. Chair lays out House Bill 2010 as pending business. Oh, I'm sorry. Members, back up. We are going to hold off on that. There's some, their office has asked us Senate bill stuff, so we're going to hold off on that one. I'm sure that got on the tape just right, correct?
That's fine.
Okay.
Just keep going.
The chair lays out, we'll try to clean that up if we have to later. The chair lays out House Bill 2337 as pending business by Representative Ollerson. Members, we heard this bill in committee last week. House Bill 2337 relates to the provision of certain intensive outpatient services and partial hospitalization services under Medicaid. Representative Shaheen moves that House Bill 2337 without amendment be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank.
Aye.
Vice Chair Rose. Representative Click.
Aye.
Representative Shaheen.
Aye.
Representative Ramos.
Aye.
Representative Noble.
Aye.
Representative Campos.
Aye.
Representative Hull.
No.
Representative Manuel.
There being 8 ayes and 1 nay, the motion prevails. Chair lays out House Bill 2473 as pending business by Representative Busey. Members, we heard this bill in committee 2 weeks ago. House Bill 2473 relates to improvements to the Texas Information Referral Network. Representative Shaheen moves that House Bill 2473 without amendment be reported favorably to the full House with the recommendation that it do pass and be printed. Clerk, please call the roll.
Chair Frank.
Aye.
Vice Chair Rose.
Aye.
Representative Click.
Aye.
Representative Shaheen.
Aye.
Representative Ramos.
Aye.
Representative Noble.
Aye.
Representative Campos.
Aye.
Representative Hull.
Aye.
Representative Manuel.
There being 9 ayes and 0 nays, the motion prevails. The chair lays out House Bill 2557 as pending business by Representative Buckley. Members, we heard this bill in committee last week. House Bill 2557 relates to the Licensed Professional Counselors Compact. Representative Manuel offers a committee substitute. This committee substitute just fixes a citation error in the original bill. Is there objection to the adoption of the committee substitute? The chair hears none, and the substitute is adopted. Representative Manuel moves that House Bill 2557 as substituted be reported favorably to the full House with the recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank.
Aye.
Vice Chair Rose.
Aye.
Representative Click.
Aye.
Representative Shaheen.
Aye.
Representative Ramos.
Aye.
Representative Noble.
Aye.
Representative Campos.
Aye.
Representative Hull.
Aye.
Representative Manuel.
There being 9 ayes and 0 nays, the motion prevails. Chair lays out House Bill 3199 as pending business by Representative Noble. Members, we heard this bill in committee last week. House Bill 3199 requires those seeking employment at a child care facility to submit a pre-employment affidavit. Representative Campos moves that House Bill 3199 without amendment be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank.
Aye.
Vice Chair Rose.
Aye.
Representative Click.
Aye.
Representative Shaheen.
Aye.
Representative Ramos.
Aye.
Representative Noble.
Aye.
Representative Campos.
Aye.
Representative Hull.
Aye.
Representative Manuel.
There being 9 ayes and 0 nays, the motion prevails. The chair lays out House Bill 3462 by Representative Noble as pending business. Members, we heard this bill in committee last week. House Bill 3462 relates to the consolidation of the ombudsman programs administered by the Health and Human Services Commission. Representative Hall offers a committee substitute. The committee substitute relates to the original bill, restates the original bill into a bill drafted by alleged counsel. Is there objection to the adoption of the committee substitute? The chair hears none, the substitute is adopted. Representative Hall moves that House Bill 3462 as substituted be reported favorably to full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank.
Aye.
Vice Chair Rose.
Aye.
Representative Click.
Aye.
Representative Shaheen.
Aye.
Representative Ramos.
Aye.
Representative Noble.
Aye.
Representative Campos.
Aye.
Representative Hull.
Aye.
Representative Manuel.
There being 9 ayes and 0 nays, the motion prevails. All right. Chair's now going to hand the gavel over to our vice chair, and I'm going.
Good luck.
Make it happen.
Make it-
A few eyes.
Is Smithy here?
He's next. We're gonna skip this one.
All right. The chair lays out House Bill 1219 and recognizes Representative Reynolds to explain his bill.
Good morning, Vice Chair and Chair Rose, members. I appreciate the opportunity to lay out House Bill 1219. In December of 2022, the Austin American Statesman research revealed that since 2010, state agencies have investigated 80,000 allegations of abuse, neglect, and exploitation in group homes serving the intellectual and developmental disability population. Criminal background checks of employees in these groups' homes are crucial to ensuring the safety and well-being of Texas' most vulnerable individuals. These individuals are usually unable to defend themselves against abuse, neglect, or exploitation. A criminal background check can help identify any history of violent or abusive behavior by potential employees to help ensure that our most vulnerable are not put at risk. House Bill 1219 will require background checks on all employees of group homes. It prohibits the operator or owner from hiring or retaining an employee if the individual has committed certain offenses. Some of the offenses include, these are more serious offenses like assault and battery, robbery, arson, fraud, and theft. It would create a Class A misdemeanor offense if the owner or operator of the group home violates this policy. So members, in essence, what this bill is designed to do is to make sure that people who are working in these group homes, that they can pass background checks so that they're not potentially harming people who basically can't defend themselves. I have some witnesses that are here. I'm open for any questions if you have any, and I reserve the right to close.
All righty. Members, are there any questions for Representative Reynolds? All right,
Thank you,
we will
Chair.
now begin public testimony on House Bill 1219. Yes, I do. Thank you. The chair calls Rebecca Jobco, President of PART. Thank you for being here today. We show you registered as Jessica Jobco.
Rebecca.
Oh,
Should be Rebecca Jepko.
listen, I didn't sleep well last night.
That's
Rebecca. Okay, I'm sorry,
That's
Miss
okay.
Rebecca Jobco, and you are president of PART.
Right. That's
All right.
Parents and Allies for Remarkable Texas, the
And you're
statewide,
what? And you're representing yourself.
and representing myself
Okay, and you will be testifying for the bill.
for the bill.
Okay.
Right. Thank you for giving me this opportunity, Chair Rose and committee members. I'm going to allude also to the articles that Representative Reynolds said. After reading the Austin American Statesman's expose, there was also an article on BuzzFeed News on the provider BrightSpring, and after viewing the WFFA series on abuse, neglect, and exploitation happening at group homes, there is no doubt that Texas has a serious and life-threatening problems for those with intellectual and developmental disabilities. As a former executive director of a 22-bed Alzheimer's facility, I had to perform a criminal history check for all new employees. In addition, I had to do an employee misconduct registry search, and I had to do a nurse aid registry check. Both of those last two are done annually. I'm asking you to vote yes for House Bill 1219 so Texas can begin the process to protect its most vulnerable citizens by requiring the minimal criminal history check for those who apply to work at a group home. I just want to let you know Texas needs to lead an open and frank discussion about abuse, neglect, and exploitation, a discussion that includes individuals, families, advocates, providers, and legislators. We should have a zero-tolerance policy with teeth. No excuses, no second chances. We need to increase the salary, training, and expectations for direct support professionals. And with those raised salaries, raise standards, both together simultaneously. There's no way around it. I want to thank you for this time.
Thank you for your testimony and being with us today. Excuse me. Members, do you have any questions for the witness? No questions. Okay. The chair calls Jerry Monroe. Miss- Mr. Monroe, thank you for being here today. We show you registered as Jerry Monroe, and you're testifying on behalf of yourself.
Yes,
And you'll be testifying for the bill?
yes, ma'am.
All right, thank you.
Thank you. I apologize for moving slow. I got a bad knee. I saw the bill pop up yesterday. I had no ideologies of coming here today. But I really think that it's a great bill. I think we really need to do the background checks, but we also need to double down. And we need to check the credentials of the people that are running these homes. You have somebody who's running a home in Houston by the name of Candace Matthews. And according to the guidelines, you need a master's, PhD to do this. This is what you call a fake transcript. I've located at least 9 fake transcripts. She's an administrator, and she's also a person that has these homes. So if the administrator's not right, why would the workers be right? We've located, this is one. These are what you call fake documents. This is what she used to get her foster home. Now I'm asking if somebody can, because I've already reached out to the Texas Rangers, because she has defrauded the state of Texas by the sum of $22 million in 8 years. And somebody dropped the ball and let her get through. So like I said, if we're gonna do this, I think there should be an amendment to where we check everything, all the credentials. She even, the bottom line is, she has 2 masters, she has 2 bachelors, 2 masters, and 4 doctorates. And all 4 doctorates were received in the year 2005. I located one in Stockholm, Sweden. And she is killing my tax money and yours. So if somebody can direct me to the person I need to speak to, maybe over Health and Human Services, I'll be glad to give them that whole box of information I have on the floor. Thank you once again, and thank you for all that you do on a daily basis.
Thank you, Mr. Monroe, but I want to clarify. Mr. Monroe,
Yes, ma'am.
I want to make sure you are for the bill, correct?
Yes, ma'am.
Okay, you are for the bill. Wait, in 1 second, members, are there any questions for the witness? Representative Chair Click?
What type of facility are we speaking about?
Ma'am, I can't hear you.
What type of facility?
What type of facility? Mm-hmm. She has multiple foster homes. Multiple. And the documentation, the way we got the actual one from USC, and we got to the registrar of USC, who verified that the prospective student never attended the school. We did an open records request with Health and Human Services. We got the actual application that was done in 2014, and inside that application was a fake transcript from USC. So my thing is, especially with special needs kids in these homes, if these people don't have the necessary education to actually be able to deal with these babies, then we're gonna have a serious problem. And honestly, this is really a joke. This is a joke. And I got on the road at 3 o'clock this morning to come down here just to speak to you good people. So if I can get to whoever, maybe the chairman or maybe you, and I'll be glad to give you all this. If not, I'll give it to the Texas Rangers, and then it'll make the state of Texas look like we doing something wrong. Somebody dropped the ball. Somebody dropped the ball, and we gotta fix this. We cannot allow this to go on. $22 million in 8 years? No. And the reason I know it's 22 million because we got the 990s. We got the tax forms.
Okay, so you're saying that you received those documents from HHSC?
Yes,
And
ma'am.
you were able to verify that they weren't, but the agency was not able to verify that they were?
Yes, ma'am. What we did is once we got the open records request, we reached out to Southern California, who, according to the law, could not release any information in regards to the student. But because the student never attended the university, they were able to verify, and I have the email in my documentation from the registrar, that the student never went there.
Okay, and you all were, we talking about group homes, but I
Yes.
guess it's your testimony that you're
Yes,
just saying
ma'am.
that they need to look out for all.
Well, I think that the bill needs an amendment because if you're going to do background checks, then you need to make sure that the people that are running the homes actually have done everything that they need to do. If, like me, I'm in college right now. I had no clue I'd go back 4 years ago. But every time I sit at my computer to do my work and I think about this, it turns my stomach because I'm doing it. And the thing is, if you want to run a group home or whatever you want to run, you need to make sure that you do it the right way. Somebody knew that this lady was not qualified to do what she did. I'm not going to say somebody got paid, but something went on. And more importantly, I can show you where we turned in a official complaint last year, I think it was July 22nd, to Health and Human Services, and the complaint came up missing. So that's why I drove it down here today, because it ain't gonna come up missing this time. This needs to, right now, this person needs to be under investigation, and everything needs to cease until you can figure it out, who the powers may be can figure it out. But I mean, we all know her. The big cowboy hat with the belt buckle, real loud.
Thank you, Mr. Monroe. Oh, I have another question. Representative Ramos.
Oh, girl. Sorry.
Two beautiful ladies, I'm sorry.
Good morning, sir. Who is we?
Ma'am,
You said you keep referring to we. Who is we?
I have a team. I have a team that I work with, some journalists, some private investigators, and as a team, we do the work, and we try to find where the corruption is, and then we try to get to the people that can actually do something about the corruption.
Okay, and you also referenced a complaint to HHSC, and so if we were to request information from them, they would, you said it was lost. You followed up and they
The
don't.
complaint was filed by Colleen Vera last year, and according to Colleen, when she did a check on it, they said they couldn't find it. It's very, very detailed, and all of a sudden, they just couldn't find it.
Okay, and last question, how did this come on your radar? Like, why is this important to you? I understand the bigger implications, but how did this come on your radar?
The way it came on my radar, I was investigating some fake presidential medals. And the young lady who I'm speaking about, who had nothing to do with what I was investigating, decided that she would stick her nose in my business. So when you did that, let me dig into you and figure out what's going on. But I knew Colleen had filed the actual complaint. So I called Colleen, and that's when she told me I never heard anything back. They say they couldn't find it. I say, well, let's just keep going. So at that time, I only had these three, and I kept digging. And then I found 3 more in Stockholm, Sweden, allegations from this same person that they went to Texas A&M, Temple. All this is on the applications. But when you look at it, how can you, example, if you're running a group home, you need a license. So we're gonna stick this doctrine on that license. Now, you wanna be an administrator, you're gonna put USC over here on this document, and then you're gonna put Macedonia, which is not an accredited Bible college, which is in Nigeria. You're gonna stick this one on this document. Why not just stick one on both documents? Because none of them are valid. Not one. The only certifications that this young lady has is a cosmetology license from San Jack. That's it. Nothing else is legal.
Oh, thank you, sir.
You're welcome.
Appreciate it.
Okay, but I just want to clarify that the bill is about group homes, Mr. Monroe. I understand you may have some issues and concerns, and I suggest you reach out to HHSC again regarding that issue. All right. At this, what? Oh, all right. Mr. Reynolds, at this time, there are no other witnesses signed up to testify. Is there anyone else who wishes to testify on for or against House Bill 1219? Seeing none, public testimony is closed, and the chair recognizes Representative Reynolds to close on House Bill 1219.
Thank you, members. So I'm hoping that this body will find this bill favorable so that we can make sure that when people go to work in these group homes, that they are able to have sufficient background checks so that no one poses a danger to the vulnerable populations that are being there to be served. There have been a rampant number of people that didn't have background checks, only later to find out that they had sufficient criminal history that they never should have been employed, and they put those people in danger. Many have been abused, many have been neglected, and a background check could have prevented them from working in those spaces. And with that, I close and ask for your favorable consideration.
Thank you.
Thank you.
If there is no objection, House Bill 1219 will be left pending. Is there objection? The chair hears none, and HB 1219 is left pending without objection. All right. I don't see any. Got lucky today. All right, the chair lays out House Bill 2933 and recognizes Representative D'Orazio to explain his bill. My apologies.
Thank you very much, Madam Chairman. It's D'Orazio.
D'Orazio.
It's easy to remember. Raise the garage door, D'Orazio, and
I'll never forget it again.
and your
D'Orazio. Never.
D'Orazio. Thank you, Madam Chairman and members, for the opportunity to lay out House Bill 2933. A constituent who you'll hear from later today and his wife have adopted children. While the wife can make medical decisions and provide information regarding their children's Medicaid benefits, the husband cannot. This creates undue frustration and hardship on families around the state. The issue of only one parent being listed as a consenter stems from the impact system used by the DFPS and the tier system used by the HHSC. The impact system is a legacy system which only allows one person to be listed as the legally authorized representative. It's not the result of statute, regulation, or policy of the licensed Medicaid administrators. HB 2933 proposes a statutory change ensuring, if applicable, both parents of adopted children can be listed as medical consenters and be able to provide and receive information on their child's Medicaid benefits. This statutory change will require the DFPS to update their legacy system to account for multiple legally authorized representatives and will require a smaller update to the tier system to account for the exchange of additional data between HHSC and the DFPS. The fiscal impact of this bill is roughly $784,000 over the biennium, with the cost being related to upcoming the impact system. The tiers can be updated using existing resources. I'll be happy to answer any questions. and reserve my right to close.
Thank you.
Thank you.
Members, are there any questions for Representative DeRazio? Did I say it right?
You got it.
Thank you. Thank you. Okay, we have, do we have a one witness? Oh. At this time, the chair calls Chris Fales. Mr. Fales, thank you for being here today. We show you registered as Chris Fales, and you're testifying for the bill, and you're testifying on behalf of yourself. Is that correct?
Yes. Thank you, Madam Chair. Thank you, representatives. I just want to appreciate you all for your service and your time being here today. Like Representative DeRazio said, he is my representative. I am a constituent of his, and I am a parent of 3 children that I've adopted out of the state foster care system as a cancer survivor. And whenever they rolled over from the foster system as adoptive parents, one of my children needed a refill on their medication. It happened that that medication was due the day that the change happened. My wife was unable to make the phone calls that day because she is a very busy professional person. She has a master's degree. She was working in the healthcare industry, actually. And she called, said, "Can you take care of this?" So I was calling, trying to get this taken care of. And I was told that I was not able to take care of this because my wife is the parent. And under our Medicaid system, you're only allowed to have one parent, and that is my wife. So therefore, part of this, there will probably be an unintended impact, because I know this is limited to adoptive parents, but this will probably affect foster parents and even parents just on the Medicaid system whenever this is updated, because this is just a technology issue. But right now, if my wife were to have an accident and be incapacitated for some reason, I would not be able to handle anything medically for my children. God forbid. If my wife is out of town, she's got to make those phone calls. I can't handle anything. So I know that this is a fiscal impact. I am a fiscally minded person. I don't want to spend tax dollars, but there's times when it needs to be done. I was a mayor, and I knew that there were times whenever we needed to fix a road in my town. And I think that this is a time where we just need to fix the system. Thank you for your time. If anyone has any questions, I'll be glad to answer them.
Thank you, Mr. Fels. Members, Representative Manuel.
Good morning. Thank you for being here. I had a quick question, and I don't want to use you as an example. If a parent was in your situation, and let's say a parent was either incapacitated or they passed in that situation, who would have been able to call in the prescription for that child?
I would have had to go through the complete process of applying to HHS and having her removed and me replaced before I could do anything.
Wow. Thank you so much. I appreciate that.
Okay. We need a. Okay. All right. We're going to call up Mr. Fels. We're going to call up a resource witness at this time. The chair calls Brock Boudreaux. Thank you, Mr. Boudreaux.
Good morning, Vice Chair Rose, Committee. My name is Brock Boudreaux. I'm the Deputy Associate Commissioner for Child Protective Services.
Okay, could you, Representative Noble has a question.
I'm trying to wrap my head around why you would make a system with only one spot. I mean, I get that it's an old system, but why in the world was this ever a decision that was made with only one spot for one parent on there?
I don't think that it was intentional to only have a single payee. I believe that the way that the system was created was once a person adopts some youth out of foster care, they move from the Star Health system into a different Medicaid package. At that point, we appoint whomever is the foster parent, one foster parent is only in the field, that's the payee for that Medicaid package. That's the person that transfers over to tiers. But there's only one slot. We can't adjust that so that there can be two or more.
Two or more, because I just feel like this should have been done a long time ago. This should never have been. I'm trying to fathom why that was a decision. I get your explanation, but we need to get this fixed.
Yeah. Members, Representative Manuel.
I don't know, I'm pretty sure you heard the first witness was saying that he would have to go through a process in order to be added onto that list. Do you know how long that would take for someone to have to be added on the list if, for an instance, a parent was incapacitated or no longer with us?
Representative Manuel, I don't know how long that process would take. I'm not familiar with those details, but that would be a Medicaid issue.
Okay,
You'll have to go back through that package through HHSC.
perfect. Thank you so much.
Okay, so, and we are talking about adopted parents, correct? So if two parents adopt a child, I don't understand why both parents don't have the ability to make, to request medication for their child.
No, I think ideally they would, Representative Rose, but the system in tiers only accepts one person. Once a youth is adopted, we will adjust the medical consenters to the parents of the youth. That will be two people, and then there will be two other backups beyond that. There's actually 4 medical consenters that can have access to that, making decisions about that youth. But tiers will only accept one. We only send one over for tiers. If we can make adjustments for interoperability between the two systems, we can have one, I'm assuming possibly more than 2 medical consenters recognized by tiers.
Well, why did Mr. Fales have a problem requesting his medication if you're saying that?
He's not listed as the medical consenter. His wife must be the medical consenter as representative in the tier system for the Medicaid package for the youth.
This is the strange, okay. I'm sorry. Thank you. I appreciate it. Well, members, any other questions? All right. Thank you. Appreciate it. All right. No more other witnesses? Okay. At this time, there are no other witnesses signed up to testify. Is there anyone else here wishing to testify on, for, or against House Bill 2933? Seeing none, public testimony is closed, and the chair recognizes Representative DeRazio to close on his good bill, House Bill 2933.
Madam Chairman, thank you, and I'm so proud of you in getting my name correct. Thank you again for your time. This bill is a common sense bill. It's seeking to solve a problem that should not have existed in the first place. The only reason it exists is because of an out-of-date computer system. With the passage of this bill, parents around the state will be able to finally make medical decisions for their children and their families, and they'll be relieved of the hardship of that has unintentionally been created. I ask that the committee report favorably on House Bill 2933.
Before you close, Representative Noble has a question.
Did you do a rider on this bill by any chance for the fiscal note?
I did not.
Okay.
Yeah.
We'll have to figure that out. All right.
Okay.
Thank you.
Thank you. Any other questions? All right. Thank you.
Make sure you close.
Sorry. With that, I close. Thank you.
If there's no objection, the bill will be left pending. The chair has none, and House Bill 2933 is left pending without objection. The chair lays out House Bill 3119 and recognizes Representative Smithy to explain this bill. Representative Smith, I understand you intend to have changes to this bill. You may explain any changes that the substitute will make, and the substitute language will be distributed after the hearing.
Okay. And so, thank you, Madam Chair. And this bill is a recommendation from the Office of Inspector General at HHSC, and it relates to third-party liability, basically to reflect changes in federal law that go into effect, I believe, January 1, 2024. And so it's really necessary to be in compliance with federal law for a number of reasons. But third-party liability basically requires, it ensures that Medicaid remain the payor of last resort. And so you've got other insurance companies like car insurance, workers' comp, long-term care, where you have double coverage. And the way Medicaid is structured in Texas and other states is that Medicaid should be the payor of last resort. And so the states have been directed by CMS to update their statutes to reflect the changes. It does several things, none of which are particularly substantive, but it adds a definition of third parties that's consistent with the federal code, adds a deadline of 60 days for third parties to respond to the state's inquiry about a claim, includes language that supports the prompt pay by third-party health insurers, and decreases denials of claims for procedural reasons, and requires third parties to accept the state's prior authorization for items or services covered under the Medicaid state plan. It also makes a few technical corrections that are non-substantive in nature. And so that's about all I know about the bill, Madam Chair.
Thank you, Representative Smithy. Members, are there any questions? No. Yeah. Okay. There are no witnesses for your bill. Is there anyone who wishes to testify on or for or against House Bill 3119? Seeing none, public testimony is closed, and the chair recognizes Representative Smithy to close on House Bill 3119.
Thank you, Madam Chair. I think I scared them all off. So, so with that, I'll close.
All right. If there is no objection, House Bill 3119 will be left pending. Is there objection? The chair has none. And House Bill 3119 left pending without objection. My vocal cord needs to warm up. All right, let's go. The chair lays out House Bill 3985 and recognizes Representative Rainey to explain his bill.
Thank you, Vice Chair Rose and members, for allowing me to lay out House Bill 3985. Last session, the House passed unanimously approved an amendment to Senate Bill 1648 regarding continuity of care for Medicaid recipients with complex medical needs, but it was later removed by the Senate in conference. House Bill 3985 is the same measure as previously adopted by the House, ensuring continuity of care and encouraging Medicaid provider enrollment and retention by further protecting contracts and allowing Medicaid patients to keep their trusted providers without anticipated risk of an abrupt disruption from accessing home support. Currently, a Texas Medicaid managed care organization can terminate a durable medical equipment provider at any time without cause. If this happens, the biggest stressor is on the patient and the caretaker by creating a fear of losing continuity of care for their critical medical supplies needed for daily life-sustaining living. An example would be an interruption of, did something to my screen, there we go. Interruption of any supplies for respiratory, such as ventilator, prescription foods, wound or ostomy, or catheters. Therefore, it is incumbent upon us as a state that we ensure Texans with complex medical needs maintain continuity of care in their daily lives. Simply asking them to track down a new DME supplier that may or may not provide the service they need, with the added responsibility of being forced to reestablish authorizations, prescriptions, is simply unreasonable. Under current law, a patient often picks the MCO based on who is currently in network. If the MCO can terminate without cause at any time, the patient's access to critical life-sustaining services and equipment may be disrupted by having to find a new provider. House Bill 3985 seeks to correct this deficiency and provide continuity through the end of a contract, plus a 90-day transition to either establish a new contract or for that patient to go to another provider. There is no fiscal note on this bill. We have witnesses here that can speak more on this issue. Members, I thank you for your time, and I reserve my right to close.
Thank you. Members, are there any questions for Representative Rainey? Okay, we will now begin public testimony on House Bill 3985. The chair calls Adrian Raholt, Government and Payer Relations with the Texas Medical Equipment Providers Association, TexMEP, and herself. So I just want to clarify that you are here today and you're showing registered as Adrian Raholt, and you're testifying on behalf of the Texas Medical Equipment Providers Association, TexPEX, and yourself. All righty.
Yes, thank you, Vice Chair Rose, and thank you, Representative Rainey, and the members of this committee. I do represent Texas Medical Equipment Providers Association, and we are testifying in support of the bill. TexMEP is a nonprofit state association of durable medical equipment used in the home, known as DME or HME. TexMEP's statewide association of home medical supplier professionals provide primary function, life-sustaining specialty medical equipment for the medical home. We're the boots on the ground for the medical home. We contract with every MCO in the state and every county, yet only 20% of our membership is willing to take Medicaid due to the administrative burden and low reimbursement costs. We provide critical equipment such as wheelchairs, respiratory supplies like ventilators, oxygen, catheters, insulin pumps, feeding machines, incontinence supplies, mastectomy items, and breast pumps. We also provide licensed clinical supports like dietitians, respiratory therapists, assistive technology professionals. Our industry is small and only accounts for roughly about 1% of Medicaid spending. Timeliness of these custom prescribed and appropriate services of this equipment is critical to keep the patient at home outside of an emergency room, institution, or hospital. We believe that clarification in code is necessary to improve continuity of care for this vulnerable population by implementing a belt and suspenders approach of aligning commercial payers with Medicaid. The 90-day bridge of coverage would come at the contract end and not at an arbitrary termination. An MCO, as mentioned, can fire a DME provider at any time without cause. If they do, the biggest stressor is on the patient and caretaker. They lose immediate access to their critical supplies that are needed daily in their life-sustaining living. And then we have many examples of that. But patients and caretakers need continuity in their daily living, not to have to track down new specialty providers for these very custom supplies. And it forces the patient to reestablish relationships and authorizations and prescriptions. We request your support of this legislation to bridge the gap of the medical complex and the fragile population in the state, and welcome you reaching out to us for more information. Thank you.
Thank you. Members, are there any questions for the witness? Thank you. At this time, the chair calls Jamie Dutzinger with the Texas Association of Health. Dutzinger. Jamie. With the Texas Association of Health Plans. And you are against the bill.
Yes. Good morning. My name is Jamie Dudensing. I am the CEO of the Texas Association of Health Plans, and I am testifying in opposition respectfully to House Bill 3985. First, I really think it helps to provide some clarification. This bill is amending the private health insurance code, not the Medicaid code, which means it's not impacting Medicaid, but it is creating definitions that we do not think are appropriate in the private health insurance market. It is amending a very long-standing patient protection that was actually put in place towards the end of the Bush administration called the Texas Patient Protection Act around continuity of care, around physician terminations, any physician termination, in a contract that assumes that you get continuity of care for 90 days. That currently exists in the private market. That has existed successfully for more than 20 years in the private market. We are very concerned that changing the terms in this statute could have a serious negative impact to the private health insurance market as a result of trying to make this change. The new part in here that is attempting to add Medicaid in to this private insurance piece, I just want to point out that we do not, in the private health insurance market, consider durable medical equipment a specialty provider or physician. That is not how it's handled in the entire private health insurance market, and to place this Medicaid conversation into the private health insurance market could have also very negative consequences. We have been, on our Medicaid side, we have been a part of these conversations, whether it was 1207 and 19, or the bill 1648 that was in last session 2021 that dealt with this conversation in the Medicaid space. And while we do have concerns about significantly changing that definition in the Medicaid space, we do not think it's the insurance code and having a negative impact on the private health insurance market is the right place to be having that conversation. And I'm happy to take any questions on the bill or on this issue.
Members, are there any questions for the witness? Chair Click.
Jamie, if you've got a vendor under a Medicaid plan and the agency has charged them with fraud, I mean, how do you guys handle that? I mean, wouldn't you have to remove them from your panel of
Are you talking about
providers?
in the Medicaid space or the private
In the
health
Medicaid
insurance?
space.
Yes, in the Medicaid space, if, it depends on the extent of how, where it is with the OIG in different pieces. So a lot of times you might have a patient hold, like a payment hold during, if you're in a certain part of an investigation versus where the finding has actually been made of fraud or abuse, and then patient, dollars are recouped. And at that point, it's not even a matter of just removing them from our panel. They are not allowed to be enrolled in the Medicaid program anymore on that front. But as far as negotiations go around, if you're referring to DME, a lot of times, it's really just negotiating, making sure you have an adequate network of supplies, of DME suppliers in that network, and going through that process that provides both the best deal for taxpayers, because these are taxpayer dollars and it is very expensive, and ensures access to those services.
Yeah, I know I've read several articles in that space where there's been fraud involved.
I will say that when you go, you can Google this. If you start Googling where you have the highest levels of fraud and highest levels of increase in prices, DME is up there in the list of items where you're seeing like 20% increases in spending and costs, not in the Medicaid program, but nationally, and where you see and have to be very mindful of abuse and fraud. It was one thing that we found when Medicaid managed care expanded back in 2011. You would find thousands and thousands of resale of Medicaid items in warehouses, and it took a while to track down all of the things that were happening in the in the early days of the managed care expansion that happened. But that did create significant savings. I do think the Medicaid managed care plans do a very good job of trying to handle that up front rather than chase it at the end.
Thank you.
Thank you. Any other questions, members? All right. Thank you.
Thank you very much.
At this time, the chair calls, I'm going to take a stab at this. Kay Garamani. I'm sorry. Ms. Garamani, we show you listed as Kay Garamani. You're the CEO of the Texas Association of Community Health Plans, and you're testifying against the bill. Is that correct?
Yes, ma'am.
All right.
I'm Kay Garamani, the CEO for the Texas Association of Community Health Plans. Really happy to be here with you this morning. We respectfully oppose House Bill 3985. The bill is well-intentioned, but there's consequences that have driven us to need to oppose the bill. I'm going to just lay out three of those issues. First, the bill would be impossible to operationalize because it would require for the preferred provider plan to know when that provider has contracted on the Medicaid side, and that's just not information that they're going to know, and it's not information that's currently, exchanged between a preferred provider plan. They're not going to know if that provider is contracted on the Medicaid side. And also the bill seems to imply that the preferred provider plan's obligation to pay for the provider services would go away once the provider signs a Medicaid provider contract, and that's untrue. So the linking of those two things, the provider getting the contract on the Medicaid side and then the obligation going away on the PPO side, doesn't really make sense because that PPO is always going to be the first payer. So I thought that language was a little confusing in the bill. The second thing I wanted to mention and kind of echo a lot of what Jamie is saying is that providers of DME are not specialty providers. That term in the healthcare industry is meant for specialists, physician specialists, so pediatricians, cardiologists, urologists. House Bill 3985 would change in statute this widely understood term and embedded in the insurance code, and that's where things become permanent unless there is a big effort to change them. So we have concerns about doing that, embedding that in the insurance code, and not really knowing what the consequences are on the TDI side. On the Medicaid side, HHSC defines specialty provider in regulation, so it's in rule, and it includes 52 different specialties in its definition. HHSC went through a long deliberative process to come up with their definition. They had a lot of stakeholder input, and they purposely excluded DME providers from its definition. STAR Kids plans, and 4 of my plans are STAR Kids plans. That includes Cook Children's, Driscoll in South Texas, Cook, of course, in Fort Worth, and Dell Children's here in Austin, and then Texas Children's in the Houston area. So all 3 of those 4 plans do provide STAR Kids, and then also Community First Health Plan in this Bexar County area. Although it's less than ideal for a provider to be out of network, the STAR Kids plans do support this requirement, and that was in legislation that you all adopted a couple of sessions ago. We certainly want for our members to have access to the specialists that they need. It does provide continuity of care to have that requirement in place. Texas does not have enough physician specialists. However, there are hundreds of DME providers in this state. And of course, it's different than a service that's provided, an interaction between the patient and the provider. Now, I do think DME providers do a really great job. They specialize, and we do have just numerous great DME providers.
Could you wrap up your testimony?
Oh, yes, sure. Just wanted to mention that HHSC does require health plans to make 50% of their payments through alternative payment models. And if you've got providers out of network, which would be a consequence if you make DME providers specialists, then that takes away an opportunity to do an alternative payment with them. So,
thank you.
Anyway.
Members, are there any questions for the witness? All right, thank you.
Thank you very much.
Appreciate it. Come on, the witness. At this time, there are no other witnesses signed up to testify. Is there anyone else who wishes to testify on, for, or against House Bill 3985? Seeing none, public testimony is closed, and the chair recognizes Representative Rainey to close on House Bill 3985.
Thank you, Vice Chair Rose. I appreciate y'all listening to me, and I've asked for your favorable consideration. Now close.
If there is no objection, the House Bill 3985 will be left pending. Is there objection? The chair hears none, and House Bill 3985 is left pending without objection. The chair lays out House Bill 4696 and recognizes Representative Noble to explain. The chair lays out House Bill 4696 and recognizes Representative Noble to explain her bill. Representative Noble, I understand you intend to have changes to this bill. You may explain any changes that the substitute will make, and the substitute language will be distributed after the hearing or during the hearing. You may begin.
Thank you, Madam Chairman. Forgive me the opportunity to lay out House Bill 4696, and I do intend to bring a committee substitute, and it was put in my inbox at 7:40 this morning, and so anyway, I'm grateful for you allowing me to explain the changes, and I have done a handout on those changes. This is one of the two bills that I'm bringing today that we discovered was necessary when we did our organizational meeting back at the beginning of session to clear the backlog of investigations that we learned about for adult protective services. So here's the background. The consolidation and transformation of the Health and Human Services system required in the 84th legislative session, which happened in 2015, transferred responsibility for conducting investigations of abuse, neglect, and exploitation in long-term care settings to HHSC. However, the legislation only moved some of the authority to receive, prioritize, and assign allegations of abuse and neglect for investigations to HHSC, leaving DFPS still responsible for some home and community-based services. This bill seeks to fully integrate investigations of regulatory noncompliance and investigations of abuse, neglect, and exploitation in all long-term care settings. This bill will increase efficiency, eliminate the duplicative on-site visits to providers, and help address an unprecedented backlog of long-term care complaints and abuse and neglect investigation at HHSC. Sadly, it's not a quick fix. But it will begin the long process of clearing that backlog. And we do have a resource witness here from HHSC that can better answer any questions.
Members, are there any questions for Representative Noble? We will now begin public testimony. Give me 1 second. Okay. So the chair calls Carmen Tilton with the Texas Assisted Living Association. Ms. Tilton, you are representing the Texas Assisted Living Association, and you are testifying in favor of the bill.
Yes.
Is that correct?
Yes, ma'am.
Thank you for being here with us today.
Thank you all. I'm Carmen Tilton. I'm with the Texas Assisted Living Association. You might wonder why we have any sort of vested interest on a bill that does not actually tackle assisted living. We think this clarification and consolidation of complaint intake reporting at the Health and Human Services Commission will actually make it easier and better for our families, our residents, our long-term care ombudsman, and our other employees to know where to go if they see something that feels concerning. So within assisted living communities, we have training. Our staff are required to be trained on reporting abuse, neglect, exploitation, and other sort of serious violations to complaint intake at the Health and Human Services Commission. But we also frequently have other providers within our buildings. And when those providers and that reporting should go to somewhere else, it can get a little bit tricky trying to distinguish what goes where and what goes somewhere else. This bill is a nice streamlining. It's kind of a one door, one entrance, and then let the agencies figure out who all the appropriate people are. We appreciate that. We appreciate Representative Noble for bringing it forward.
Thank you. Members, are there any questions for the witness? Thank you, Ms. Hilton. At this time, the chair calls John Woodley. And you're representing the Advocates for Disability Access and yourself. Thank you for being here today. We show you registered on behalf of the Advocates for Disability Access and yourself, and you're testifying, oh, you're neutral on the bill. Okay. Is that correct? You're neutral?
I'm neutral.
Okay. You can go ahead with your testimony.
Okay. Hello, I'm John Woodley. I'm with Advocates for Disability Access. And I would like to talk a little bit about adult protective services. Under the Health and Human Service Code, it's where it says it's illegal to abuse, neglect, exploit elderly persons or persons with disabilities by hospitals, nursing home, family members, caretakers, and other individuals with an ongoing relationship. There's no definition for other individuals with an ongoing relationship. And when I communicated with the Adult Protective Services, they said they're using a definition that they created under the administrative code for other individuals with an ongoing relationship. And they basically just copied the same thing, hospitals, nursing home, family members, caretakers, and then they specifically excluded contact. So if you're being abused by a landlord or exploited by an insurance company, you're not being, you don't have any recourse. So the State Board of Insurance is not protecting people with disabilities from being exploited by insurance companies. The Texas Department of Housing and Community Affairs and the Texas Workforce Commission Civil Rights Division, which handles housing, also is not protecting people with disabilities from being discriminated against, abused, neglected, exploited, abandoned, endangered. When we call the police tell us to contact, that is a civil matter, and to contact Adult Protective Services. So, and the other state agencies all say contact Adult Protective Services. So basically, Adult Protective Services is not investigating abuse, neglect, and exploitation of elderly persons with disabilities. We suffered from the winter damage, and I was the living aid for an elderly person with a disability, and I have a disability myself. The landlord refused to fix the unit. The housing authority failed the housing quality inspection, and then the landlord retaliated by non-renewing and terminating a lease. But this also happened the previous year when she asked for reasonable accommodation to put in a walk-in shower. They retaliated by non-renewing and terminating lease. It's very abusive. So these are other areas that we need protection against abuse, neglect, exploitation that that is not happening at this time. And when we contact Disability Rights Texas, legal aid, volunteer legal services, or go to a legal clinic, they all say they don't have resources or they don't know that area of law. So,
Thank you, Mr. Woodley. Members, are there any questions for the witness? Representative Noble.
Thank you, Madam Chairman. I feel your plight here, and I'm sorry that that's happening. Sadly, this bill only deals with individuals that are in long-term care facilities. So I can't really address this in this bill, but it's a great point that you bring up.
Right. And speaking of some areas where this bill, like nursing home, I know a person who was hospital because of a condition, then had to go to a rehabilitation facility. And when we got there, they it was actually a nursing home, and when they said they were ready for her, they were not. They didn't have the correct bed, they didn't have her medication, and the staff didn't even know how to change her tubing.
Thank you, Mr. Woodley. We appreciate your testimony.
All right, thank you.
Oh, okay. At this time, there are no other witnesses signed up to testify. Is there anyone else here who wishes to testify on, for, or against House Bill 4696? Seeing none, public testimony is closed, and the chair recognizes Representative Noble to close on House Bill 4696.
Thank you, Madam Chairman. I respectfully request passage.
If there is no objection, the bill will be left pending. The chair has none, and House Bill 4696 is left pending without objection. That's what I just did. All right. Oh, okay. The chair lays out House Bill 4694 and recognizes Representative Noble to explain her bill.
Thank you, Madam Chairman, for giving me the opportunity to lay out House Bill 46.
Wait, hold up. The chair offers a committee substitute for House Bill 4694. You may begin your
Great,
testimony.
thank you. I am laying out a committee sub, Madam Chairman, and this one we do have. We have been able to provide to everyone. The change in that between the one we filed and the one that this is simply a legislative council draft. This bill also seeks to address the investigation backlog by removing inefficient or duplicate training requirements for HHSC long-term care regulation survey staff. These antiquated requirements divert efforts away from surveying investigative work. Removing these requirements allows staff to focus on their core mission of protecting the health and safety of our residents and on prioritizing investigations. We do have a resource witness here from HHSC, and I'm happy to answer any questions and reserve the right to close.
Members, are there any questions for Representative Noble? We will now begin public testimony. The chair calls Carmen Tilton, representing the Texas Assisted Living Association. Thank you again for being here today. We show you registered as Carmen Tilton on behalf of the Texas Assisted Living Association, and you will be testifying for House Bill 4694. Is that correct?
That is correct. Good morning. This is Carmen Tilton with the Texas Assisted Living Association. House Bill 4694 repeals an annual training requirement, which is in statute for surveyors, facility, assisted living communities, facility supervisors, and other staff regarding aging in place. As this committee discussed last week, assisted living managers are required to complete 12 hours of continuing education on topics that are listed out in the Texas Administrative Code. And then other direct care employees are required to complete 6 annual training hours of continuing education, also on topics listed out in the Administrative Code. So by repealing this from statute, you still have the Administrative Code with those topics listed. Pursuing an aging in place waiver for communities is actually a fairly complex multidisciplinary process where you have to have buy-in and support from the resident's legally authorized representative, the physician, the community itself, and then other individuals as appropriate. And then because it's such a complicated process and because there are so many other moving pieces, the Health and Human Services Commission released a provider letter with careful step-by-step details that should be followed to request an aging in place waiver and the elements that should be reviewed before pursuing one. In addition, the Health and Human Services Commission has an annual, or rather not an annual training, has a webinar available for free and made available to communities to review, again, before pursuing this process. We think both of those, the provider letter and the webinar, are actually far better resources because you can pull them up to reference them when you're pursuing an aging in place waiver rather than having a single training requirement that you have once a year and then you don't utilize until you actually need it later on. We appreciate all of Representative Noble's bills that give HHSC the flexibility and the ability to prioritize resources for surveyors. Our communities work really closely with the Health and Human Services Commission. We think a strong agency is just good things for our communities.
Thank you. Members, are there any questions for the witness?
Thank you all.
Okay. No witnesses? Okay. At this time, there are no witnesses signed up to testify. Is there anyone here who wishes to testify on, for, or against House Bill 4694? Seeing none, public testimony is closed, and the chair recognizes Representative Noble to close on House Bill 4694.
Thank you, Madam Chairman. I just want to do a compliment to the staff at HHSC and how hard they've worked on this and the effort they've put into trying to clear the backlog. And with that, I respectfully request passage.
The committee substitute is withdrawn, and if there is no objection, the bill will be left pending. The chair hears none, and House Bill 4220 is left pending. Wait, I'm sorry. Let me go back. The committee substitute is withdrawn. If there is no objection, the bill will be left pending. The chair hears none, and House Bill 4694 is left pending without objection. All right. The chair lays out House Bill 1289 and recognizes Representative Campos to explain her bill. Representative Campos, I understand you intend to have changes to this bill. You may explain any changes that the substitute will make, and the substitute language will be distributed after the hearing.
Thank you, Vice Chair. Good morning, Vice Chair and my fellow committee members. Thank you for the opportunity to lay out House Bill 1289 relating to establishing a training program for persons investigating suspected child abuse or neglect. During the interim, my office received many calls from constituents who were named as alleged abusers, and the investigation process turned into be their worst nightmare when they thought everything would be cleared up once the department reviewed their situation. These families were in fear of the department, and when I reviewed these cases with my staff, there were major inconsistencies in how cases were handled compared to the policy training, which can at best be contributed to poor retention. A DFPS Administrative Review of Investigations Findings report from 2020 indicates that when parents requested an administrative review, roughly 50% of cases were overturned, resulting in case depositions being changed due to poor investigative work. While an administrative review is separate from the legal case, the data gives the legislature direct insight at how inadequately trained many of these investigators are when directly handling cases. HB 1289 seeks to codify an investigative program. The program will include comprehensive understanding of abuse and neglect definitions, the option of an abbreviated case or administrative closure, in which turn will help investigators triage cases and manage their caseloads better, required notices to alleged perpetrator, rights provided by the Fourth Amendment, proper investigation protocols and techniques, including how to properly photograph alleged physical markings, identify protective capabilities of children 13 years and older, and other vital knowledge to provide an accurate disposition on the case. An investigator and the investigation supervisor cannot be assigned to report cases until they have successfully completed the program and passed an examination. The reason that I bring this bill to us today is because I did a lot of work during the interim, and it was a bit disappointing to see what some of the caseworkers and investigators were going through. And I feel like we just need to give them a little bit more support to make things better for our children. And I will share one case that really touched me during the interim. There was a woman who, she was a grandma. She had joint custody of her grandson because her daughter was diagnosed schizophrenic, and that was the purpose of her getting joint custody. Mom had an episode. CPS was called. The child was removed. The child was 10 years old, and he was autistic. CPS removed him, put him in a group home for 6 months, and would not release him back to grandma. it took me to get involved to call the commissioner at the time. It turned out that, you know, the caseworkers, there was 10 caseworkers on this one case. And that's just one case that I worked on. There was another case where a mom called because she thought that her daughter was maybe, there was issues with an uncle that had come over. And she called CPS because she wanted to make sure that her daughter was okay and there wasn't a perpetrator. One thing led to another. CPS pretty much turned on her, took her girls away, gave them with, you know, her mother. But still, like, after meeting with caseworkers and investigators, I just saw, you know, that they are lacking a lot of training. And so this is the whole purpose of my bill. And I could go on and on with different cases that I worked on. So with that, I reserve the right to close. And if anyone has any questions, I'm here.
Okay.
Thank you, Vice Chair.
Oh, you're welcome. Members, are there any questions for Representative Campos? Representative Noble?
Thank you for bringing this bill, but I'm going to ask, this is pretty extensive, the requirements you've put in. Are these duplicative? Because I know there's already requirements in
Right.
code for our CPS investigations. Are you deleting other ones and putting these in? Or are you adding to the list of things that they need to be trained on?
I'm adding. Yes, yes.
But so these are not, all of these are not already in code, or are they somewhere else in code?
A lot of them are in code, but not, a lot of them are. But there are some new ones that I've put in.
So why didn't you just add the new ones and leave the others out? I'm just trying to focus in on what's different about the list you have here as opposed to what they're already doing. Do you have any idea about that?
Yeah, I mean, I can go through that with you. Let me just take a look at the bill.
Or we can do it at another time.
Yeah, that'd be fun.
Okay. Thank you, Madam Chair.
Thank you.
Okay. Members, are there any other questions? We will begin public testimony. At this time, the chair calls Andrew Brown, Associate Vice President of Policy with the Texas Public Foundation. Thank you for being here today. We show you registered as Andrew Brown, and you're testifying on behalf of the Texas Public Policy Foundation, and you're testifying for House Bill 1289. Is that correct?
Yes, ma'am.
Okay. Begin your testimony.
Good morning, Vice Chair Rose, members of the committee. Andrew Brown, Texas Public Policy Foundation, in support of House Bill 1289. Over the last several sessions, the legislature has passed significant reforms intended to solve ongoing problems at the Department of Family and Protective Services and transform the Texas child welfare system. Some of this work is bearing fruit, and that's encouraging. But in my conversations with many of you, as well as other stakeholders, one word keeps coming up again and again as a major root cause of this frustration, and that word is implementation. For example, we know that Vice Chair Rose passes only the best bills, and she can pass every single excellent bill that she wants to, but it's all for naught if those policies never actually make it into practice. House Bill 1289 is intended to help address this implementation gap in child protective investigations by requiring the Department of Family and Protective Services to develop an in-depth training program that every CPS investigator and supervisor will be required to complete. This training program includes critically important areas that have been the subject of recent reforms, including the legal definitions of abuse and neglect, investigative standards, and my personal favorite, the constitutional rights of families. During my career, I've had the privilege of helping to reunite families who were wrongfully separated by a CPS investigation. Although each of these cases was unique, they all shared a common thread. In each one, the lead investigator on the case made major mistakes during the investigation that were rooted in a lack of understanding of the basic laws, policies, and procedures governing the conduct of that investigation. I say this not to cast aspersions on all investigators, but to point out that many of the problems that make it to your desks are the result of a lack of consistency across the state. House Bill 1289 will help provide consistency in the training received by CPS investigators and raise the bar for quality casework by setting high expectations for knowledge and professionalism. 1289 is not a silver bullet that will solve all of the problems facing our child welfare systems. However, I believe it will go a long way in improving the conduct of investigations and ensuring that the reforms enacted by the legislature are well implemented for the benefit of all Texas families. Thank you for your time.
Thank you. Members, are there any questions for the witness? Thank you, Mr. Brown. At this time, there are no other witnesses signed up to testify. Is there anyone here who wishes to testify on, for, or against House Bill 1289? Seeing none, public testimony is closed, and the chair recognizes Representative Campos to close on House Bill 1289.
House Bill 1289 will resolve the lack of transparency in alleged abuse investigations, which has otherwise created a serious distrust of the children welfare and disorganization and consistency within the state child abuse investigations. It will streamline in investigative training expectations and allow the parties involved to an investigation to have clear understanding of the investigation and family rights before an unnecessary parent-child suit is brought to an overbroad court system. With that, I respectfully ask for your support. Thank you, and I close.
All right, there's no objection. House Bill 1289 will be left pending. Is there any objection? The chair hears none, and House Bill 1289 is left pending without objection. Is he here? Okay. Just two. Okay, let's go. All right, the chair lays out House Bill 4170 and recognizes Representative Campos to explain her bill.
Good morning, Vice Chair Rose and my fellow committee members. Thank you for the opportunity to lay out House Bill 4170 relating to enforcement actions taken against a child care or child placing agency administrator's license. Current Human Resource Code statute create a gap in HHSC's ability to ensure operators of child placing agencies with a history of significant health and safety violations may not immediately open a new CPA after HHSC refuses to renew their current license. Outdated statute in the same chapter of the code also conflicts the new language added in later legislative sessions, but this outdated language has not been repealed. HB 4170 will address the current gap in the Commission's ability to supervise operators of CPAs with known health and safety violations. Required individuals to operate CPAs to wait 5 years before reapplying for another license if HHSC refuses to renew the current license, and will provide assurance that only qualified operators are eligible to renew an administrator's license. This bill will also repeal Section 43.011 of the Human Resource Code because it directly conflicts with Section 43.0106, which became law in 1997. Despite the conflict, the legislator did not repeal the former section. This has created confusion and inconsistencies for the administrative hearing process if HHSC denies a license or purposes to suspend, revoke, or refuses to renew a CPA license. I'm open for questions and respectfully reserve the right to close.
Thank you. All right, members, are there any questions for Representative Campos? We will now begin public testimony. Okay. There are no witnesses. Is there anyone here who wishes to testify on, for, or against House Bill 4170? Seeing none, public testimony is closed, and the chair recognizes Representative Campos to close on House Bill 4170.
HB 4170 will close the gap in HHSC's ability to better supervise child care placement agencies with known history, respond to those violations with more meaningful consequences, and will repeal conflicting sections of the code that is conflicting so agencies will have a clearer understanding for license renewals and revocation process. I respectfully ask for your vote, and I close.
If there's no objection, House Bill 4170 will be left pending. Is there objection? The chair hears none, and House Bill 4170 will be left pending without objection. The chair lays out House Bill 4220 and recognizes Representative Clardy to explain this bill.
Thank you, Madam Chairman, for your impeccable timing.
Excuse me. The chair offers a committee substitute for House Bill 4220.
All right, thank you, Madam Chairman. Members, thank you for the opportunity to lay out House Bill 4220. As the chairwoman has appropriately noted, there is a committee substitute. This bill has to do with the Ombudsman Program in the state of Texas, specifically the State Long-Term Care Ombudsman Program. The Ombudsman Program is a particularly important role that the state offers. It has to do with making sure that the residents of the state of Texas and long-term care facilities have access and ability to talk to ombudsmen who they know is specifically there for their benefit to provide support and information concerning their rights as residents in the state of Texas. We have I think we all agree the state has an important and compelling state interest in this very important regulated industry to make sure people are treated ethically and with integrity. And I know that that's what that office intends to do. There is, however, certain issues that have come up, and I think what this bill hopes to do and its intention is provide clarity and guidance on where the lines are. And what we've seen in practice and the testimony you hear from the witnesses today is that there are times where the ombudsman role has shifted, where the lines have blurred between the role that the agency has to regulate the industry and to take, where necessary, regulatory or enforcement actions through grievances or other processes, versus the role of the ombudsman, who is there in a support role. I think too often we've seen that line has blurred, and there seems to be a doubling down on investigatory issues and fact-finding and fault-finding, when in fact the ombudsmen are particularly there, specifically there in a support role. I do this akin to sometimes often see in courts to a situation with a situation where CASA is involved, where there may be a child custody issue involved, and there's an ad litem appointed to the court, not to be there to enforce the state's law, but to be there to provide support and specific duty to that child and support with the family. Their role is very difficult because it's very fact specific. It's very case to case to case, a lot of subjective analysis of it, and it varies depending upon the resident, the location, and then of course the discretion of the ombudsman as they attempt to do their job. There are more than 100 full-time staff members of the Ombudsman Office and nearly 300 volunteer ombudsmen. Again, I'd make that somewhat analogous to a CASA volunteer. These providers, long-term care providers such as nursing homes, assisted living facilities, are directed by the state to give the ombudsman, quote, immediate, private, and unimpeded access to residents, all areas of the facility, and resident records. So they do have a broad grant of power to do their job to support the residents. The Texas statute does not follow the federal rules for the types of records they are ordered to request, and this ambiguity has caused confusion for both providers and the volunteer ombudsman, and I think in times for the families and residents themselves. The point I would make is that the ombudsman do this. They testify. They're involved often in the rulemaking process in the interim. So there's times they may testify, it's like today, in commission hearings or in committee hearings, but then throughout the regulatory rulemaking process, we'll go and testify on specific matters and then do that perhaps in mediations and other roles. And what we're trying to do is make sure there's a consistency. Sometimes it seems the left hand doesn't know what the right hand's doing, and you see inconsistent application of rules and positions taken by the Ombudsman Office. And so really if I were to say the focus of this bill is to add an additional requirement to clarify what they've done, and in these situations to do the work they've done, but to then document it and then have that transparent and available for everybody. So when they do testify on a position, simply put, they take the position they're going to take, they put that down in writing. It's the information is provided currently, but it's in no way collated, organized, and it's not clear where they've done it, who's done what. And so what this would do is really force the ombudsman to do their job, but document it. And so we know, residents know, and it'll be a helpful tool for everybody to have to, again, make sure we're seeing consistent treatment around the state. Hopefully it'll provide guidance for them to continue to do their job and do it better. And then when there are issues where there are inconsistencies, that can be addressed and pointed out, I think, to the benefit of everybody who's trying to serve the long-term care population in Texas. So thank you for noting that we do have the committee substitute. I will note we do not have a fiscal note on this bill. That was with the original. I do not anticipate there will be a fiscal note, but that's not been made available at the time of today's hearing. But again, I do not expect there to be a fiscal note. So members, with that, I would reserve the right to close. I'm happy to answer any questions at this time the members may have.
Members, are there any questions for Representative Clardy? We will now begin public testimony of House Bill 4220. The chair calls Mary Nichols with Texas Caregivers for Compromise, and sell. So Ms. Mary Nichols, thank you for being here today. You're registered on behalf of Texas Caregivers for Compromise and Self, and yourself as well. Is that correct?
Yes, ma'am.
And you're testifying against the bill. Is that correct?
Yes, ma'am.
Okay.
Thank you. Madam Chair and committee members, every section of this bill is for the sole benefit of facilities, lobbyists, and provider groups, not residents. Yet federal law and regulations state that the purpose of the Ombudsman program is to provide services for the health, safety, welfare rights of the residents, not the interests of facilities and providers. Residents do not have administrators, owners, corporate owners, provider representatives, or lobbyists to look out for their interests. Facilities do. Residents only have the Ombudsman. So it seems unfair that this bill allows facilities to now encroach into that. This bill allows facilities to choose which records an ombudsman can use in an investigation of its own facility. It codifies language into state law that actually says it's unnecessary for an ombudsman to thoroughly document an investigation. And it requires that state ombudsman, as you heard Representative Clardy state, to create an itemized library of its advocacy efforts. And what this actually does is it helps providers strategize against the long-term care ombudsman program and thereby strategize against the very residents that long-term care ombudsman advocates for. Facilities and providers will always be unsatisfied and inconvenienced by the long-term care ombudsman program. There's not anything we can do to legislate to correct that. And there will always be ombudsmen that make missteps. We can't legislate against human error either. But now that providers have gotten this bill filed, we can certainly expect to see in the next session further bills chipping away at the ombudsman program and its ability to protect the rights of residents. I had hoped to tell you how this bill would have affected my own mother, but in the interest of time, I'm going to just close with this. What I know from working in municipalities is that whenever there is a global fix put in place to address specialized concerns, it creates more and harder problems to resolve. And in this case, committee members, the residents who will suffer the most will be adult orphans, the least educated, the most alienated, the lowest income. It will be our immigrants, and it will be the marginalized population of our long-term care communities. For whatever reason, they're marginalized. And in other words, it will be those people that need those ombudsmen the very most. Thank you.
Thank you. Members, are there any questions for the witness? Thank you, Ms. Nichols.
Thank you.
At this time, the chair calls Carmen Tilton with the Texas Assisted Living Association. Thank you again, Ms. Tilton, for being here. We show you registered as Carmen Tilton, and you're testifying on behalf of the Texas Assisted Living Association, and you are for House Bill 42.
I am. I'm a bit of a frequent flyer at this committee in the past
42.
couple of weeks. No, I appreciate getting to this bill before session starts. Good morning. My name is Carmen Tilton. I'm the VP of Public Policy with the Texas Assisted Living Association, here in support of the committee sub for House Bill 4220. This bill creates a common expectation for both long-term care providers and the state long-term care ombudsman in our communities about the types of documents which ombudsmen may request. It improves transparency about the office to legislators, families, and residents. This bill does not limit an ombudsman's access to records. It makes clear what the records are that the ombudsman has access to by adopting language from the federal statute. It does not limit an ombudsman's ability to resolve complaints for residents. The ombudsman's ability to resolve complaints is described in federal law. This bill does not restrict that important function. And the bill does not increase burden or workload. The bill requires information be reported which should be easily accessible and which is a core activity of the office. The federal rules in 45 CFR 1324 govern the long-term care ombudsman program. Those rules establish 3 categories of information which may be requested as part of an investigation. The categories are the medical, social, and other records relating to a resident if the resident has provided informed consent. The administrative records and policies and documents to which residents or the general public have access, and copies of all licensing and certification records maintained by the state. By contrast, Texas's statute in the Health and Safety Code says the state long-term care ombudsman and representatives shall have access to patient care records of residents as provided by commission rule. And those commission rules say that the ombudsman is entitled to all files, records, and other information concerning a resident. The discrepancy between the clear limits outlined in federal rules and the term patient care records in the Health and Safety Code and the nearly unlimited access to documents in the Administrative Code have been a source of confusion. When ombudsmen request materials which are clearly outside their scope of authority, providers are put into an uncomfortable position of either saying no and risking penalties for impeding the investigation, or giving the ombudsman private business and resident information despite misgivings. This bill eliminates the discrepancy. It puts providers and ombudsmen on the same page regarding resident records. It establishes a clear understanding. Some documents, such as those developed as part of a risk management review, are simply outside the scope of the ombudsman's purview. Under this bill, the ombudsman must provide the community with a document showing that the individual, the resident, has consented, and that the ombudsman has consent from the resident to view the resident's sensitive healthcare and financial information. It clarifies a long-standing point of confusion for families regarding what an ombudsman is, and it expands an existing report to include formal positions on bills during the legislative session and on comments submitted to state agencies for rulemaking.
Okay,
Thank you for your time.
Thank you, Ms. Tilton. Members, are there any questions for the witness? Okay, thank you. At this time, the chair calls Alice Meyer with Leading Age Texas. Thank you for being here today. We show you as Elise, okay, Elise Meyer. And you're here on behalf of Leading Age Texas, and you will be testifying for the bill, correct? House
Yes.
Bill 4220, okay.
Yes, thank you, Madam Chair and members. My name's Elise Meyer, VP of Advocacy with Leading Age Texas in support of HB 4220. Leading Age Texas represents the full continuum of not-for-profit aging services providers in Texas, including nursing homes and assisted living communities. We support HB 4220 because this bill addresses ambiguities concerning the role of the Long-Term Care Ombudsman Program in existing rules, policies, and procedures. It creates greater clarity in statute where it's needed. Our members strive to set the industry standard in care and services, are a trusted voice for residents and families, and are held accountable under the regulatory framework they operate within. This bill seeks to address gaps in training by ensuring ombudsmen understand the difference between nursing homes and assisted living, a common issue across communities. The bill will make clear the information accessible to ombudsmen by aligning federal and state statute pertaining to access to records. HHSC may assess an administrative penalty against facilities that interfere with the state ombudsman's duties. There is no formal provider guidance regarding the types of records or documents that must be shared. Providers must assume that ombudsmen are accurately interpreting and applying the regulations. Communities are focused on caring for residents. In good faith, providers give ombudsmen immediate, private, and unimpeded access, which can leave providers vulnerable when sharing sensitive information. In addition to their core functions, the office publishes brochures and informational materials on topics of interest to residents, families, and providers, and our members make those resources available in their communities. Unfortunately, most residents and families cannot distinguish between HHSC and the Ombudsman Program, which creates confusion. A more detailed disclosure that may be tailored to the intended audience can help better distinguish the role of the office. In closing, the long-term care ombudsman is essential to the long-term care ecosystem. The office is unique as they represent the interests of residents and are independent of other governmental entities. They are also a helpful resource when resolving conflicts and resident complaints. We believe this bill clearly distinguishes the role of the ombudsman and will improve the ability of providers to comply by creating greater transparency, setting clear expectations and guidelines.
Thank you. Members, are there any questions for the witness? Thank you. The chair calls Jeff Miller with Disability Rights. Jeff Miller? Okay. We'll show him as did not testify, but put it against the bill. Okay, Lauren Gherkin with Texas Council of Developmental Disabilities. Lauren Gherkin? Okay. We'll show her test. Andrea Earl with AARP. Thank you for being here today. We show you registered as Andrea Earl, and you're testifying on behalf of AARP, and you will be testifying against House Bill 4220. Is that correct?
Correct. Thank you, Chairwoman Rose and members of the committee. I'm Andrea Earl. I'm here in opposition of the bill representing AARP and our nearly 2.3 million members in Texas. We advocate on behalf of our members to help ensure that they can live their best life as they age, and often we assist them in finding resources they need as they age. The State Long-Term Care Ombudsman Program is one of our most reliable and trusted resources we turn to when contacted by family members on or about a concern with the facility. The Ombudsman serves as an advocate for residents of assisted living and nursing homes, providing information on how to find a facility, what to do to get quality care, and they are trained and responsible for investigating and resolving problems on behalf of a resident. Specifically, as has been stated, relating to health, safety, welfare, and the rights of individuals who live in long-term care facilities. This important office investigates complaints ranging from improper eviction, administration of medications, and unanswered requests by staff on a regular basis, and more. We don't often receive complaints about the Office of an Ombudsman. We often receive complaints about facilities themselves, and we are interested to work with the representative on this bill to get clarity between parties. However, an essential office for consumer protections is this office, and we are concerned that specific parts of the language do deviate from federal statute. One particular section is the only place that we have issued, and that's Section A1 of the bill that adds language regarding normal course of business and documents obtained through litigation. are not considered to been attained through normal course of business. Look, we have questions that arise around what if the complaint has nothing to do with said litigation, but needed records are wrapped up in litigation? How can the ombudsman do a thorough investigation? If each facility operates differently, how is normal course of business defined in this situation? We are working with the bill's author and his other stakeholders on this, and we are grateful that some middle ground has been met on other parts of the bill. We still stand to thoroughly advocate on behalf of residents through this program and want to assure that records can be accessed. And we appreciate the ongoing dialogue and the safety and clarity that this bill is trying to achieve. Thank you for your time.
Thank you. Members, are there any questions for this witness? Thank you for your testimony. This. Okay. At this time, the committee substitute for House Bill 4220. What do you have for other witnesses? We're going to get back to it. Okay. I'm sorry. At this time, the committee substitute for House Bill 4220 is withdrawn, and House Bill 4220 is left pending without objection. The bill will be laid out as pending business for more public testimony after the committee reconvenes. The chair moves that the committee stands in recess until final adjournment, recess of the House, or during bill referral if permission is granted. Is there objection? Hearing none, the motion prevails. The committee stands at recess.